On the CBS Health Watch this morning, dry skin. Winter's cold temperatures and brisk winds can dehydrate and crack the skin. Your face has it especially rough this time of year since it's more likely to be exposed to the winter weather. So how can you protect yourself? Let's get some advice from Dr. Michele Green, a dermatologist with Mount Sinai Medical Center here in New York City. Dr. Green, thanks for coming in. We appreciate it. First of all, do you need to buy different moisturizers for different parts of the body?
No, that's a myth. You don't need a different moisturizer for your face or for your body. You can use the same moisturizer since it's the same skin on your entire body.
Now, I know that men, I need to moisturize as well. Is our skin different? Anything we need to worry about in particular?
No, men's skin needs to be moisturized just as much as women's skin. For some reason, men are reticent to go to the store and buy a moisturizer or go to a dermatologist, but they need to take the same good care of their skin as women do.
Okay, let's talk about the face in particular here. Some parts of the face are dry, some parts are oily. Does that mean we need to moisturize the entire face?
Actually, that's a really good question because you don't need to moisturize the entire face. What you should just do is put a moisturizer on to spots that are dry, not to the oily areas, because if you moisturize the oily areas, then you get acne and other problems.
Which parts of the face tend to get more dry?
Okay, the parts of the face that get dry are really the parts that are exposed to the cold climates, like your nose, your ears, your cheeks, your lips, basically your extremities.
Okay. First up, I guess the cheeks would be the first thing to go?
The cheeks would be the first thing to go, exactly, especially when it's so cold out like it is now.
What do you do to combat that?
So you want to use a very, very mild soap, and you want to use a very mild moisturizer. And what that means really is you want to use a really good moisturizer for the face, and use something to wash your face that's lipid-free, that's non-drying. Basically, when you look for soaps, you want to look for something that's not glycerin-based, meaning not a clear soap. People use the clear soaps during the summer when you're very, very oily, but when you're dry in the winter, you want to use a moisturizing soap.
Okay, I'm protecting my cheeks now. What are these?
Exactly.
Which one of these products am I going to use?
Okay, you're going to use one of these products, one of these good moisturizers to protect your cheeks, and they're hypoallergenic on the face because you want to use something that's basically made for normal people as well as patients who may have sensitive skin, especially this time of year.
Okay, let's talk about my eyes now. What do I use for those?
Okay, for your eyes, you want to use a product that also is hypoallergenic, and you want to use a product that has a moisturizing and Vaseline base. I like to recommend products to patients that either you can use either itself or moisturizing products like in the tube. Patients come in with a little bit of tube, which is easy to carry. It's almost like a Vaseline petrolatum base. It's in a wand, and you can apply it to your eyelids, around the eye areas, to the eyelashes themselves, all the areas that get dry.
Okay, what about the lips? They get dry awful fast as well.
The lips are really, really dry. And there are all sorts of things that are out now for the lips. There are patients who are addicted to Blistex and things like that.
Yeah.
But you can use, depending on how dry you are, you can use anything from a chapstick base, but you want to use something that has an SPF 15, even in the winter, because there is sun during the winter. There's UVA damage all year long. And they're also medicated. I brought steroid ointments as samples to show that there are stronger medicated products that you can use for that time of year too. Now the moisturizers are coming in stick-based too, like Curel is coming with a moisturizing stick-based cream that you can put out as an ointment on your lips or dry areas as well.
We've got about 30 seconds left. There are all these moisturizers in the store. Is there a big difference there, the amount of money you spend? Does that correspond to how good the product is?
No, that's a myth. Patients always come in and ask me that same question. There is no difference between a $7 moisturizer and a $170 moisturizer. The difference is really in the packaging, and you want to just look for something that's dermatology tested, that's hypoallergenic, and that's fragrance free, and then you're using a good moisturizer, so you don't need to spend a lot of money to have a good product.
Okay, Dr. Michele Green, happy holidays to you.
Thank you very much.
Thanks a lot for coming in. We appreciate it. We're going to come right